Hello guys, who is excited? Let's go as we take a beautiful look at the top 20 MCQ questions on introduction to anatomy. So we're going to be going through all of them one after the other. Let me give you the rules of the game. Number one, don't check anything, like just be with me directly. Are you getting me now? That's number one law. Don't check anything, just flow with me and see how many you are going to get on your own. That's number one. Number two, ensure you are subscribed to this channel if you are not yet subscribed. The sponsor of this class is Learnliftapp. Oh yeah, let's go together and see a lot of beautiful stuff we're going to look at. Now look at the first amazing question, question one. Wow, so you can see the muscular structure of the female body, and you can see the posting that she's posting. Oh wow, yeah, let's go guys. Question one here says what is the primary focus of histology in anatomy? Histology, don't forget. Option A says study of cells, option B says study of tissues, option C says study of organs, and then option D says study of body system. Now, where will histology follow us or focus on? When they say study of cells, that's your cytology, right? Then study of your tissue is called your histology. That makes option B the correct answer. Let's go guys. Did you get that? Look at question 2. In our beautiful question 2, the question says, which plane divides the body into anterior and posterior? Under the planes of the body, we focused on 4 major planes that we have to know. To say the first is called the median plane, or the mid-sagittal plane, or the median sagittal plane. The second plane and that median plane divides the body into 2 equal halves, which is the right and the left. Then we have another called the sagittal plane. Sagittal plane is parallel to the median plane, and it divides the body into 2 as well, right and left. And both the median and the sagittal plane, both of them are your vertical plane. And then we have another vertical plane, which is called the frontal or the coronal plane, and it divides the body into what? Anterior and posterior. And then the third is called the transverse or the axial or the oblique plane. Are you getting me now? That divides the body into superior and your inferior. So these are the various planes of the body that we've treated. Option A says sagittal plane, the one that divides the body into your anterior and posterior. I'm sure you know the answer now. Option B says coronal plane. Option C says transverse plane. Option D says median plane. Of course, the answer cannot be median plane, neither can it be sagittal plane, nor your transverse plane. What's the correct answer? Of course, it is the coronal plane. Option B is the correct answer. Why? Because coronal plane divides the body into what? Anterior and posterior. Let's go to the next question 3. Our beautiful question 3 says cytology is the study of tissues. Cytology is the study of tissues. Oh yeah, is it correct? Option A says true. Okay, true or false? What's the correct answer? Cytology. When you hear cytology, it has nothing to do with tissues. That's your cells. The study of cells, the structures, the functions, and everything about cells is called what? Your cytology. That makes false the correct answer to this question. Let's go, bro. Next question, question 4. Intelligent question says radiographic anatomy involves the use of imaging technique to study internal structure. The use of imaging technique to study internal structure. Yeah. Now the option here we're giving true. Okay, true or false as well. Now when they say radiographic anatomy, of course it involves imaging technique to study internal structures, and it is a non-invasive procedure. That makes true the correct answer to this question. Now let's go to the next question, question 5. In our beautiful question 5, we're giving this. Let's go. Ensure you are following me. How many have you missed now? How many have you gotten? Don't play. Which of the following are functions of the liver? Select all that apply. That means it's not just one answer that is correct here. Select all of them that apply to this. Which of the following are functions of the liver? Option A says storage of glucose. Option B says production of bile. Option C says detoxification. And then option D, we're giving synthesis of white blood cells. The liver carries out more than 1001 functions. Among the functions of the liver is number 1, it carries out what is called the storage of your glycogen. Oh yes, yeah. Now this is what happens there. You know there is insulin and there is glucagon as an hormone. We have 2 major hormones secreted by the islet of Langerhans. We have what is called the insulin, and then we have what is called the glucagon. Now what happens is this: excess glucose is converted into glycogen by the aid of insulin. So what now converts glycogen back to glucose when the body needs it? It is converted by the aid of the liver. Now, within the liver, there are a special group of cells called the islets of what? Langerhans. These are the ones that carry out the function. So storage of glycogen is a very, very correct answer. That's number one. That's correct. Option B is a production of bile. Now, bile is produced by the cells of the liver. Now, in the liver cells, anytime you hear the word liver, something should strike into you, hepato. So hepatocytes are the liver cells. So they aid or assist in the production of your bile. If they produce this bile, the bile is therefore stored in the where? In the gallbladder. So now the question is, which of the following are functions of the liver? Select order, apply. Production of bile is also correct, the function of the liver. Now, detoxification is one of the major functions of the liver, where drugs are reduced from harmful substances into substances the body can cope with. In other words, I'm just breaking that down in simple terms. The toxicity is kind of like reduced. So the body, through the liver, reduces the effect of harmful substances, and that process is called detoxification. Are you getting me now? And option D is a synthesis of your white blood cells. No, that's totally out of the way. So what becomes the correct answer? They say select all that apply in this question. Of course, option A is correct, option B is correct, option C is correct. So we're going to pick out the 3 options being the correct answers there. Now let's go to the next question, question 6. There are different skills in which college give MCQ. Let's go, guys. Question 6 here says match the following anatomical planes to their description. Match them to their description. In option A, we're given this beautiful soft sagittal plane. Option B says coronal plane. Option D says transverse plane. Match them, match the following anatomical planes to their description. Now, okay, we're also given 3 different things to match it with. We have to either match it with divides the body into anterior and posterior. Okay, let's go gradually. Now, which one will divide the body into anterior and posterior? Of course, that's your coronal or the frontal plane. Coronal or the frontal plane should divide the body into anterior and posterior. Of course, that means you're going to match option B and 1 together. That's going to be B here is going to link with 1. That's correct for that. The second one, this is 1. I'll give you the second one. Only you will match it for me. Second one here says divide the body into left and right halves. Which one we do that? Pause the video, get the answer, and then link it. Let's go. What we divide the body into left and right? If they say left and right, of course sagittal should be coming into your mind, but yes, it's left and right halves. What will not become the correct answer? Of course, okay, the left and right halves, since they are, if they are equal halves, this is it. There is difference between left and right halves and left and right equal halves. Oh, voila. If the halves, if the two parties dividing it into, if they are equal, that's median plane. Of course, do we have median in the option? There is no median between A, B, C, nothing like median there. Divide the body into left and right. Whether there is half there or there is no half there. Left and right, of course, that's your sagittal plane. But there's a special type of sagittal plane called the median sagittal plane, or the median plane that we divide it into 2 equal what halves. Are you getting me now? So that means divide the body into left and right. That's your what? Sagittal plane. That means I'm going to go with your A. A there is going to link with what? With 2. And then the third one there, that's your transverse plane. Of course, we have divided the body into your superior and inferior. What we divide the body into superior and inferior? Is that going to be the transverse plane? Yes, the transverse or the axial plane, we rather divide the body into your what? Your superior and inferior. That means your C there, C is going to link to 1, 2, 3. Of course, this is how you link the 3 of them together. Now let's go to the next question very quickly. The next question, we're giving something beautiful, and the question here says match the following levels of organization in the human body to their descriptions. Match them to their descriptions. Option A, we're given chemical level, we're given tissue level, and then we're also given organ system level. And we're to match it with these same 3 options here, and the first, the second, and the third. Okay, let's go. I'm going to give you 30 seconds so that you go through them yourself. Pause the video, go through them, and ensure you are correct so that we'll go together. What's the correct answer to this? Yeah, let's go very fast. Now, what you're going to have there is this. Your first one there says group of cells with similar structures and functions. Anywhere you have group of cells that have similar structure and function, is going to form your tissue. Are you getting me now? Group of cells with similar structure and function is nothing but your tissue. That means your B is going to link to 1. B will link to 1 definitely there. That makes this is the first one, we have gotten that. And then the second, how do we link it? Organs collaborating to perform specific functions. if you have organs that come together to perform specific function in the body, that's going to give rise to your organ system level. That means your C there, C is going to link with your 2. Are you getting it now? C will link with 2. And then what's the third one there? Now the third one there, we were given involves inorganic and organic chemicals. Now which one involves inorganic and organic chemicals? Of course, now that's your chemical level. That will make A there to go and link with what? With your 3, 1, 2, 3. So you are seeing, I'm sure you are seeing this now. So this is how you answer these kind of questions. I've gotten 1, 2, 3 and all of that. So it's very, very simple and all direct. Look at the next question here, question 8. In question 8, we're given this beautiful question. Match the following anatomical terms to their meaning. Match them to their meaning. Option A says ipsilateral. Option B says deep. Option C says prone. Option D says superficial. Match it with their meaning, and then we're giving 4 options there. Of course, 1, 2, 3, 4. Let's go. So that we can see what and what are we going to match with each other. Anytime you hear the word ipsilateral, pause the class and ensure you match them first before you continue. Anywhere you hear the word ipsilateral, what will come into your mind? Ipsilateral means they are on the same side of the body. Contralateral means they are on opposite side of the body. So ipsilateral, okay, let's go gradually. The first option there, option 1 says position nearer to the body surface. Anything that is positioned nearer to the body surface, that is superficial. That means your D, or let's say 1, will correspond directly with your what? With your D. That's the first one, correct. We are out. Now, the 2 there now. 2, tell me, what is 2 going to correspond with very quickly? 2 there says, refer to structures on the same side of the body. Structures on the same side of the body are said to be ipsilateral. That means your 2 will correspond with your A. Are you getting me now? And then the third one that we have there, number 3. What is number 3 going to correspond with? Number 3 says a body position line face downwards. A body position line face downwards. If you lie and your face is downwards, that's your prone. If your face is upwards, that's supine. Your back is on the ground and your face is upwards, that's supine. Your back is up, your face is downwards, that's your what? Your prone. That means your 3 will correspond with prone. And prone there is option C that we have there. And then what's the last one there? 4. Say position further away from the body surface. Anything that is further away from the body surface is nothing but deep. That means deep is what we correspond with 4. That means your 4 definitely is going to correspond with your deep, and deep is in your B. So all of these things we have gotten all the 4 correctly. Well, yeah, let's go. Are you getting them with me? Look at the next question. Question number 9. In our question 9, we're giving this beautiful question. Match the following levels of organization to their description. Match all of them for us. Option A say cell level. Option B say organ level. Option D say organisms level. Organism level. Match it with the following that we have there. And we also got 1, 2, and 3. Now look at the first here. The basic structural and functional unit of life. Of course, that's your cell. If it is cell, that means A there is going to correspond with what? 1. No play. That's the red. Now look at the second there. Composed of different types of tissues arranged to perform specific function. Now different types of tissues coming together is going to give rise to your organ. That's organ level. Of course, if you see this one, all the same, all of them are corresponding to B is going to match with your 2, and you don't need to stress because your C there. Though if you go and choose C will match with 3 and does not match, that means you are wrong in that area. Now the highest level, that's 3, highest level including the entire organisms, the entire living organism or the living being. So what's that? That's organism level. That means C is definitely going to correspond with 3. 1, 2, 3. That's the correct answer. So we are correct with A, your B, and your C. Let's move to the next, guys. Let's go. Question 10 here. A lovely question says that what is the main difference between cytology and histology in the field of anatomy? Cytology, cell; histology, tissue in the field of anatomy. Option A says cytology studies cell, while histology studies tissues. Option B says cytology studies cross anatomy. No, cytology is microscopic, while histology studies microscopic structure. Histology aspect there is correct, but cytology, both cytology and histology, both of them are under microscopic structures. Now C says cytology focuses on the nervous system, while histology focuses on circulatory system. No, that's not true. D says cytology is primarily concerned with surface anatomy, while histology explores internal structures. No, what's the correct answer to this question? Of course, cytology studies cell, histology studies tissues. That is option A, the correct answer. In question number 11, we are given this now. We've done 10 questions. How many have you gotten out of these 10? Don't play. In question 11, we're given this beautiful question. Okay, it's more like a clinical question. A surgeon is preparing for complex abdominal surgery. Which branch of anatomy will be most relevant to the surgeon in understanding the surfaces, in understanding the structures and relationships within the abdominal cavity? Simple. Option A says radiographic anatomy. Option B says regional anatomy. Option C says pathological anatomy. Option D says comparative anatomy. It cannot be comparative anatomy because you're not comparing any two things here. Pathological anatomy, no particular disease is being highlighted to give us strong grip or hold on that. If you say radiographic anatomy, there is nothing like any imaging modality or imaging technique there that will make it to be radiographic anatomy. A surgeon is preparing for complex, look at the striking word there, complex abdominal surgery. So abdominal surgery is the cardinal word that we are concerned there. Which branch of anatomy will be most relevant to the surgeon in understanding the structures and relationship within the abdominal cavity? Sure, you are seeing it now. In other words, you are focusing on one region of the body and then you are studying it in details. That's regional anatomy. That makes option B the correct answer. Look at the next question here, question 12. In question 12, the question says a patient is scheduled for magnetic resonance imaging, of course, radiographic anatomy, MRI scan of the brain. Which branch of anatomy is essential for the radiologist interpreting the results? Now, the radiographer will carry out the procedure, the radiologist will interpret the results most of the times. Now, option A says cytology, B says radiographic anatomy, C says surgical anatomy, and then option D says anthropological anatomy. What's the correct answer? Of course, it is your radiographic anatomy. That is option B, the correct answer to this question. Simple. Look at question number 13. Intelligent question says the anatomical plane that divides the body into anterior and posterior is called dash plane. You should know it now. The frontal or corona. Frontal or corona. What will divide the body into the anterior and the posterior part? Of course, frontal or the corona is the answer that we have said, like we've said. Now, it is, you will just fill in the gap there yourself and then you move on. What's the correct answer? The frontal or corona plane, that's the correct answer. Look at question number 14. In question 14, the study of the changes in the structure of an organism from conception to maturity is known as dash. It is not from conception to 8 weeks or from conception to birth. If it's conception to 8 weeks or birth or some of those things within and are called down to birth, it's going to give you embryology. But it's none of that. So what's the correct answer to this? Of course, that developmental anatomy being the answer. Look at question 15. In our question 15, we're given this sweet question. What is the primary focus of anatomic position in the field of anatomy and medicine? What's the primary focus or purpose of anatomic position? Why do you position yourself anatomically? Of course, the way the lady is positioning herself, that's not anatomical position. What's the primary purpose of anatomical positioning in the field of anatomy and medicine? Also, they say to study the body's internal organs. B says to establish a standard reference for anatomical description. C says to maintain a relaxed and comfortable posture. Option D says to identify specific anatomical planes. Okay, what's the correct answer? The primary purpose of anatomical position is to establish a standard reference for anatomical descriptions. Are you getting it now? Standard. Whether you are in UK, you are in US, you are in Canada, you are in India, all the answers are still going to be the same. Anatomical position in Kenya, same as anatomical position in Nigeria, same as anatomical position in Ghana, everywhere around the globe. That is option B, the correct answer to this question. Now look at question number 16. In question 16, we're given this beautiful, bright, lovely question. Which of the following is not a characteristic of anatomical position? Anatomical position, which one does not follow here? Option A says palms of the hands are directed forwards. Of course, you should know these things. In anatomical position, palm of the hands, are they directed forward? I don't know. Option B says feet parallel and flat on the ground. Option C says upper limb extend outwards from the body, and option D says head held straight with eyes looking downwards. Okay, which one is not a characteristic of anatomical position? Option A says palm of the arms are directed forward. Palm of them, are they directed forward? Yes, palm are directed forward. Are they prone or they are in supine position? Of course, they are in the supine position. Option B says feet are parallel and flat on the ground. That's correct. Upper limb extend outwards from the body. Head held straight with eyes looking forward, not downwards. So that makes option D the correct answer to this question. Look at question 17 here. In our question 17, we're given this lovely question: match the type of anatomical planes with their descriptions. The type of anatomical planes, match them with their description. We're given A to be median plane, we're given sagittal plane, we're given coronal plane, and we have to match it with any of these three: the first, the second, and the third. Bro, let's go. Now, this is it. You already know how to answer this question. Now, try it for me, guys. Try it. Now, median plane, what is it? Okay, let's go. Up the first one, the one says divide the body into anterior and posterior. Of course, what will divide the body into anterior and posterior? That's coronal or the frontal plane. And that makes C the correct answer. That means one there is going to match or link with C as the correct answer there. Now, the next is vertical plane dividing the body into two equal right and left halves. Right and left halves equal. So what's the answer there? Median plane. That means your 2 there is going to correspond with your A, median plane. Now for the third one there, we're given vertical plane parallel to the median plane. That vertical plane that is parallel to the median plane, what's it called? It's called your sagittal plane. That means your 3 there, 3 is going to correspond with your what? With your B being the correct answer. So all of these become the correct answer to number 17. Simple and direct. Look at question 18. In question 18, we're given this lovely question: match the description of the types of organs, sections with their names. Organ sections, that's where we are entering. We are given longitudinal section, we're given cross section, and then we're given oblique section. Match them with, and then we're given 3 lovely stuffs there. The first there is the section that cuts an organ lengthwise. Okay, we're given 1, 2, and then 3. Now let's go through all of this and see the one that is the correct answer there. Longitudinal section. Longitudinal section. Okay, let's go through the whole of the option. The first one there says a section that cuts an organ lengthwise. 2 says a section at right angle to the organ's long axis. 3 says a section that cuts across the long axis of an organ at an angle other than the right angle. Now, this is it here. When you hear longitudinal section, it is the long section. The one that is the longest there is the longitudinal. That means a section that cuts an organ lengthwise, it will run through the entire length. That means A there is going to match with 1. That's very correct. Now, a section that cuts at an angle to an organ's long section, that cuts at what angle? At a right angle. So we're giving right angle there. Anything that cuts at right angle, that's your cross section, is what you're going to have there. That means your B there is going to match with 2. Very correct. And then a section that cuts across the long axis of an organ at any other angle other than the right angle. That's oblique section. That means your C there is going to correspond with your what? 1, 2, 3. That's the correct answer to this. So all of them, they correlate like that. Look at question number 19. I'm sure you are getting all of this. 19 says coronal plane are imaginary vertical planes that passes through the body at right angle to the median plane. Hold on, no, and understand this. Dividing the body into dash and dash. Now, when you hear coronal plane, of course, it's called coronal or the frontal plane. It will divide the body into anterior and posterior. Now, coronal plane are imaginary vertical planes. Are they vertical planes? Yes, they are not horizontal. They are vertical planes. That's correct. That passes through the body at right angle to the median plane. Now, median plane is going to divide the body into 2 equal halves, right? Yes, into right and left. Coronal will divide the body into what? Anterior and posterior, and both of them are going to form at right angle. That's angle 90 degrees. That's correct. Dividing the body into dash and dash part, what will it divide it into? Anterior and posterior parts become the correct answer. Anterior is the front, while posterior is the back. That becomes the correct answer to this question. Now let's look at the last question. Hooray, who is excited? Look at the last question. Question number 20. Identify the tissues among the following which one is the tissue here among the following? Identify them. Okay, let's say this first one that we're giving here, this is what? Of course, this is your cell, this is your cell, this is your cell. Now, what's the aim for this type of question for your steeplechase? Are you getting me now? So as you are running steeplechase and you are hearing bearing, background, and then are you getting me so that you know exactly what to do? So this is your cell. Are you getting it? It's full at cellular level. This here is your bone. Your bone is a tissue. So bone is tissue. Of course, your cell is, and this is your cell at cellular level. And this guy that we have here, this is your heart. Heart is what? An organ. So this is at organ level. And your liver, this is liver. It's not liver alone. No, this is liver. So your liver, of course, is what? An organ. You can see that this is at organ level. This is at tissue level, and it's at cellular level. Identify the tissues among the following. What's the tissue there? Of course, bone there become the correct answer. Peace out, guys. Ensure you are subscribed to this channel. See you guys in the next class. And guess what? Our next class we're going to be looking at is the basic structures in anatomy. See you quickly there. Bye-bye.
Hello, guys. The class you just finished watching was brought to you by the Learnliftapp. If you enjoyed the content, don't forget to subscribe to the channel and turn on the notification bells so that when beautiful and educative videos drop, you would get notified.